Hello and welcome to this Portsmouth Safeguarding Adults Board learning briefing regarding a Safeguarding Adults review that was undertaken in respect of a lady who we are calling Anne. That is not her real name. My name is Karen Rees and I was the lead reviewer for the Anne Safeguarding Adult Review, and I'm here to present you with the learning from the Safeguarding Adult Review. So what is a Safeguarding Adult Review? Well, that is a formal process that's initiated when an adult with care or support needs dies or suffers serious harm and there's concern that abuse or neglect may have been a contributing factor. The review is conducted by the Safeguarding Adults Board, and it's about understanding how agencies such as health services, social care and law enforcement work together to protect individuals. Safeguarding Adult Reviews are not about assigning blame, but about learning and improving safeguarding practices. They can help identify systemic issues and promote better coordination among services to prevent future harm. Safeguarding Adult Reviews are essential tools for helping us enhance the safety and well-being of vulnerable adults in the community. So as we've said, a Safeguarding Adult Review is triggered when an adult with care or support needs experiences serious harm or death and that there is a suspicion of abuse or neglect. The review investigates whether different agencies could have collaborated more effectively to prevent the incident. It focuses on identifying missed opportunities and understanding the circumstances that led to the particular harm that occurred. The goal is to analyse the actions of involved services and determine how safeguarding measures can be improved. This definition underscores the importance of interagency cooperation and the need for us to be able to learn continuously in our safeguarding practices. So the primary purpose of a Safeguarding Adult Review is not about blame, as I've already said. It is to facilitate learning and improvement in safeguarding practices. It seeks to understand what happened, identify those missed opportunities and recommend changes for the future. By doing that, we are able to enhance that multi-agency working, improve communication and ensure that adults who have care and support needs get the protection they're needed. Safeguarding Adult Reviews involve a wide range of organisations, so local authorities, NHS, police, care providers, voluntary sector organisations. We also like to involve family members or carers because they often have unique perspectives into the person who has died or been seriously harmed that other agencies may not have. So by doing that, we can build then a comprehensive picture of the person, but also understand their lived experience of the services that they have received. So Safeguarding Adult Reviews are important not only for professionals, but also non-professionals such as family members, volunteers and community workers. Understanding Safeguarding Adult Reviews raises awareness of the safeguarding responsibilities and encourages vigilance in identifying those risks. It promotes better communication and collaboration among all the individuals involved in the care of vulnerable adults. By learning from Safeguarding Adult Reviews, communities can become more proactive and therefore prevent harm and ensuring the safety of those at risk. The insights that we can gather from Safeguarding Adult Reviews empower everyone to contribute to a safer and more supportive environment for adults with care and support needs. So in this case, we undertook the Safeguarding Adult Review in respect of a lady called Anne. Anne was 82 years old. She was a white British woman who'd formerly been an auxiliary nurse in maternity services. She was a widowed mother of 3, with 2 children living abroad and a child living within this country. When we say children, obviously Anne was 82, her children were adults. She was in a 16-year relationship with a significantly younger partner. Anne was diagnosed with vascular dementia 15 months before her death, and she was cared for at home by her partner with limited professional involvement until late in her illness. Concerns were raised by Anne's children about financial transactions between Anne and her partner. There were allegations that Anne's partner gave his own medication to Anne that wasn't prescribed for her. Anne's health declined rapidly in the weeks before her death, prompting her son to raise a safeguarding concern. Her son was specifically worried about possible neglect in the administration of the unprescribed medication. Anne's partner admitted to professionals that he was struggling to care for both Anne and his mother, had physically abused Anne, and had purchased substances online with the intention of ending his own life after their deaths. Anne died unexpectedly, and her partner was arrested on suspicion of murder. Police investigations, however, found no evidence that her partner expedited her death or engaged in coercive or controlling behaviour at that time. Over a year later, the coroner returned an open verdict on the cause of Anne's death. An open verdict is given when there isn't any other evidence for a different type of verdict. So what this slide does is highlights the effective multi-agency response to Anne's escalating needs. It shows how services were mobilised quickly, a care package was introduced, and professionals demonstrated strong commitment. Support for Anne's partner was provided through a carer's assessment and respite care. In the final weeks of Anne's life, there were multiple agencies who collaborated, and Anne's son contributed to the review valuable insights during the Safeguarding Adult review. The GP's referral ensured that we had a thorough safeguarding review. This slide highlights key improvements in safeguarding since Anne's case. What we know is that agencies had already gone to some lengths to strengthen their protocols, particularly in the local authority where they had undergone an internal learning review about what happened in Anne's case. So you can see here that we wanted quicker and more accurate responses and triage processes. And we have been told within the Safeguarding Adult Review that they are already underway. There's been a shift toward more integrated digital record systems, making it easier to access previous records. And the Safeguarding Adult Review was also told that awareness of coercive control and neglect by unpaid carers has grown, especially post-COVID. We have seen that internal audits are helping agencies to review and improve their safeguarding practices, and Anne's case has clearly influenced positive change already. So what did we learn from the review that was undertaken? And we've subtitled this, What Would Good Look Like? In terms of hearing Anne's voice, we found that Anne's voice was largely absent in her care planning, and that practitioners relied heavily on her partner's account, even when Anne did have some retained capacity. So we said that tools like dementia passports can help preserve personal history and preferences. We felt that it was important to understand the relationship dynamics. We discovered that practitioners lacked full awareness of Anne's relationship history and its impact on her. Earlier concerns regarding financial abuse and coercion from her partner weren't consistently considered, and those relationship dynamics can influence decision making, and they should be explored with professional curiosity. We also felt that it was important to balance carer and care recipient needs. Anne's partner was both caregiver and a person of concern at times. Carer stress was identified, but it wasn't always viewed through a safeguarding lens, and joint assessments of both parties are essential to understand any risks and also support needs. Safeguarding practice and legal literacy, we felt there were delays in that safeguarding triage, and we've already heard how things have improved on those elements. But the lack of Section 42 inquiries limited risk assessment in this case. Practitioners therefore missed opportunities to escalate concerns because of fragmented information. And also Anne's voice wasn't heard, and we thought that advocacy should be sought when a primary caregiver may be implicated in safeguarding concerns. Unfortunately, it was felt that agencies worked in silos, and that led to fragmented understanding. There was no multi-agency meeting convened to share concerns in historical context, and effective safeguarding, we know, requires coordinated multi-agency planning. We felt that practitioners really didn't understand about vascular dementia and how quickly it can progress, and that there can be significant step changes in the progression of vascular dementia. The family were very concerned that DNA CPR decisions were made without their involvement. These were undertaken with Anne's partner. And also the end-of-life care planning wasn't very proactive or inclusive of all agencies or the family. Again, as in other safeguarding adult reviews nationally and locally, professional curiosity came up as something that we need to learn more about. So we felt that practitioners needed to dig deeper when concerns arrive, especially where there are complex histories. And a safeguarding lens needs to be applied even when care appears adequate on the surface. Safeguarding adult reviews produce several key outputs that are essential for improving safeguarding practices across agencies. The first and most comprehensive output is the final report, which provides a detailed summary of the case, including a timeline of events, agency involvement, and an analysis of what happened. This report identifies both strengths and areas for improvement in the safeguarding response. Another critical output is the identification of key findings, which highlight what went well and where there were missed opportunities or systemic issues. These findings are used to inform future policy and practice. Recommendations are also a vital component of SAR outputs. These are clear, actionable steps that agencies should take to enhance their safeguarding procedures. They may involve changes to protocols, staff training, or improvements in interagency collaboration. To ensure these recommendations are implemented effectively, an action plan is developed. This plan outlines specific steps, assigns responsibilities, and sets timelines for completion. It serves as a roadmap for change and accountability. Learning dissemination is another important output. This involves sharing the lessons learned from the SAR through briefings, workshops, and training sessions. The goal is to ensure that all relevant professionals and stakeholders understand the findings and apply them in their work. Finally, in most cases, the SAR is published. This anonymised version of the report promotes transparency and helps the wider community understand the safeguarding process and its outcomes. Together with these outputs ensures that SARs lead to meaningful improvements in safeguarding practices and help prevent future harm. So what can you do? As a practitioner particularly, Well, you could browse the Safeguarding Adult Board website and read the full SAR and/or the learning briefing. You can discuss the learning from this review in your team meetings and/or in supervision, and you could particularly apply this learning to cases you're currently working with. Identify who your organisational safeguarding lead is and/or where you can go for advice. Reflect on what you understand about neglect and acts of omission by unpaid carers, so that we're talking about family and friends. Learn more about dementia. Become a dementia friend. Understand the roles of other agencies in your locality and how to collaborate with them. Reflect on what does it take to be a professionally curious practitioner. Ensure that you include relevant family members in all care discussions. Identify how you would escalate concerns if you're not happy with a decision made regarding a case. And challenge yourself to ensure that the person you are working with is central to your work. Access the 1-minute guide to advocacy that is available on the Safeguarding Board's website. I would like to take this opportunity to thank you for listening to this learning briefing, and also to thank those agencies who were involved and gave their transparent and unequivocal response to the questions that I had and the research that I was undertaking, that helped me to be able to, with a panel of experts from agencies, to be able to produce this Safeguarding Adult Review. Thank you.